All right. Hey, everybody, and welcome to Integrative Rehab Medicine. My name is Corey, and with me, as always, is Dr. Sebastian. How you doing today, Dr. Sebastian?
Excellent. Happy Friday, everyone.
Today, we're talking about neuropathy. But in order to get started, I need to kind of know what it is. So, Dr. Sebastian, what is neuropathy?
Well, neuropathy is a general term for basically having damage to your nerves. And there's different types of neuropathy. You can have it in your feet, in your hands. Most commonly, people have it in their feet. And basically, it's when the nerves endings are damaged and they're not working as well, and they can affect the function of the nerve.
Okay, and what causes that? I mean, does it just come up out of nowhere, or how does it work?
Well, there's a lot of things that can cause neuropathy. In our country, the most common reason is diabetes, alcohol, chemotherapy. So toxic agents like the increased blood sugars in diabetes, or the alcohol, or medications like in chemotherapy, they can actually have the degenerative and damaging effect on the nerves. And then the nerves, which are made from, there's like an inner core of the nerve, that like the axons, and then there's outer layer, the myelin. Those toxic agents can actually damage those areas, and it can cause those nerves to become injured and not function as well. Other things can cause neuropathies, like compression in your wrist can cause a neuropathy in the hand called carpal tunnel, or in your elbow, or in your spine. Very often we see a combination where patients have stenosis in their spine, which is compression of the nerves in the spine, and then they have diabetes, or maybe drank a little too much alcohol, or were exposed to some toxic agents, or maybe didn't have enough vitamins. And together that causes the nerves to be unhealthy, not fire properly, and it causes the symptoms.
Yeah, you mentioned one of the symptoms was diabetes. You might have already said this. Are there other symptoms other than
Well,
what
so
you've
no,
already mentioned?
the causes can diabetes. The symptoms. So the symptoms of neuropathy is actually pain in the feet, very common. Burning, typically is worse in the evening or when people are not active. Sometimes it gets better actually when they're moving around during the day, but in the evening it's pain and burning, stinging, pins and needles, sharp pains. Those are what we call the positive symptoms. And then the negative symptoms are the lack of certain things, like patients can't feel their feet, can't feel the floor, the lack of coordination, their balance is off, and they're walking all goofy. They have weakness, their legs and feet are not moving. Those are the negative symptoms. So people both get positive symptoms, like the pain, burning, pins and needles, usually worse at night. And then the negative symptoms, the lack of strength, balance, and the numbness.
Okay. Now, over at Integrative Rehab, and guys, the website, just so you know, is irehabmed.com. We talk about PRP, or platelet-rich plasma. How does PRP treat neuropathy?
So platelet-rich plasma is made from blood. So our blood has platelets, and platelets are filled with growth factors. There are these little tiny bubbles of growth factors. So what we do is we take the platelet-rich plasma and we inject it around the nerves. I use an ultrasound. So I find the nerves, and under the ultrasound, I find each nerve and I inject platelet-rich plasma around these nerves. And what happens is that PRP, or the platelets, release these growth factors. And some of those growth factors are nerve growth factors, or vascular growth factors. So that stimulates the nerve to start regenerating. It actually calls on these special cells called Schwann cells. They come into that area and they start rebuilding the nerves. But before even that happens, very often the PRP decreases inflammation of the nerves. So we find that the pain and the burning, the positive symptoms, go away very quickly. And then as the nerves are regenerating, the negative symptoms go away. So the strength improves, the numbness goes away, the balance improves. Typically, we do that with conjunction of physical therapy. So we're having patients work with our therapists to make sure their balance is good, that they're strengthening. So basically connecting the brain to the feet. We're re-educating that whole nervous system. We also work with them on make sure that they're eating properly. So, eat good foods with good vitamins and eliminate the stuff that causes neuropathy. So, if you were drinking too much alcohol, you got to let that go. If you have diabetes because your diet is not that good, you got to let go of some of the sugars. So we're working on that. Sometimes we use some supplements, some special vitamins to help nerve regenerate. So it's a combination. It's a very comprehensive treatment. The PRP that decreases inflammation and stimulates regeneration, then the therapy, and then the nutritional counseling.
It sounds incredible. But anybody that hasn't heard of PRP before, they're like, what evidence do you have? Is there research evidence, in human and animal studies or something of that nature that kind of proves this out?
So in our clinic, we are very much evidence-based clinic. Everything that we do has been shown by literature, by evidence, by science to be effective. We're not just a bunch of yahoos coming up with new things. Now well, we do come up with many new things, but a lot of it is based on evidence. So lots of animal studies have been shown that when you inject PRP around the nerves, that those nerves regrow faster. So animal studies where they injured the nerves and then they injected PRP, those nerves were able to regrow fast and heal much faster. Mice and animals that have neuropathy from diabetes always have shown that the nerves regrow. But there's a good human study that was actually published. This is from Egypt, where they looked at 60 patients with diabetic neuropathy. That's the most common neuropathy. And half of these patients got PRP and medical treatment. The other half patients just got medical treatment. And these patients were followed for 6 months. And they found that after injecting PRP under ultrasound around all those nerves, the patients, their pain significantly decreased the first month. And then the third month, they were still down. The 6th month, their pain was still down. And this, throughout the whole study, their symptoms of pain and numbness went away. And the patients who were just getting medical treatment didn't really make that same improvement. And when the doctors did a nerve conduction study to see how well actually these nerves are functioning electrically, they found after the PRP, their nerve studies improved, their electrical function improved. So we know that their symptoms went away and the actual nerves started regenerating, healing, and the function improved. And then when they looked at their function as far as like balance and ability to walk and everyday quality of life, it also improved.
Wow.
So we see this. This study only followed the patients for 6 months. We obviously see patients for years and years. And we usually see that we do a couple treatments. It usually takes more than one treatment, but with a couple treatments, usually 6 to 8 weeks apart, their symptoms get better and better. Their strength gets better. Their numbness goes away. And then they're good, right? When the nerves are healed, they're good, unless the patients are doing other things. If they start drinking or having a bad diet or, they're having chemotherapy or something, then the neuropathy may come back. But typically when the nerves recover and heal and the toxic agents are removed, patients are good for years to go.
That's really awesome how you talk about the way things are different at IRM. And I just wanted to kind of give you a second to talk about what makes IRM kind of the best at treating neuropathy.
Well, I think we're the best because, that's my own personal opinion. But actually, besides that, we have mastered this process. I've been doing neuropathy treatments for many, many years. I actually teach neuropathy treatments at conferences, national conferences. I was actually in Cancun in Mexico last year in September. I was teaching how to treat nerves to doctors from all over the world, and I'm going to do it again in April of this year in Vancouver, Washington, and then again in Mexico. Nice. So this is something I've been specializing for years, and I've kind of developed this program. But what it really makes the difference is, number one, what I've done is we address every single nerve. Under ultrasound, I find every nerve. So we're not just injecting into the leg wherever. I identify each nerve. Under ultrasound, inject the PRP around that nerve. And then we combine that with the comprehensive treatment, the nutrition, the physical therapy. But what we're injecting is also, I think, very superior to a lot of other PRPs. We have a lab in our clinic, and a lot of clinics, unfortunately, don't have a lab. Because we have a lab, we can collect a lot of blood and make a lot of PRP. A lot of places can't do that, but we are able to. And in order to treat all the nerves in the legs, you need a lot of PRP. And not only is it a lot of PRP, but it's a very high quality PRP. There's been some good studies, animal studies actually, showing that the PRP concentration needs to be about 4 to 6 times concentration. And in our lab, we've tested our PRP, and we can see that we are concentrating at that exact amount. So a lot of PRP, that's very high quality PRP, that's injected very well under ultrasound guidance, and then combined with the comprehensive treatment. I think that's what really makes us stand out. And that's why we get such great results. And that's why we have patients from all over the country, all over the world. I actually just spoke with a patient from Mexico a couple of days ago. He's flying in from Guadalajara to get his foot drop and foot neuropathy treated. We see this all the time because I think we're the best.
Yeah. Well, incredible. I really appreciate you taking the time to kind of explain some of this stuff to us. And of course, if you're watching this on YouTube or on Facebook or social media, there's a whole blog post about this. So we encourage you to go check it out. Or you might have been reading the blog post and found this video with Dr. Sebastian. If you did, either way, we're good to go. Dr. Sebastian, how can they contact you, and what's the best way to get started?
So obviously look at the bottom of this video. You'll see a link to our website, irehabmed.com. Again, it's irehabmed.com. Put in your information, and then you'll get a call from our patient liaison or somebody from our office, and we'll schedule either an in-person consultation if you're local, or do a telehealth or a health history review if you're from another country or another state. We'll evaluate you. We'll talk about if you're a candidate, and if you are, then you come down and we start your treatments.
Good stuff. All right, everybody. If you're looking for a phone number, it's just 239-687-3199. You can find that at the top of the website, as Dr. Sebastian said, irehabmed.com. Until next time, we'll see you later. Thanks, Dr. Sebastian.
Take care. Bye-bye.